You are listening to Therapy Plus, a mental health podcast.
The views and opinions expressed by the guest speaker on this episode are solely those of the guest. The content shared is intended for informational purposes only and should not be construed as professional advice or endorsement.
Welcome to the Therapy Plus podcast. My name is Susi Amendola, and I'm a yoga therapist and a stress management specialist, and the author of the book, The Centered Heart. I want to talk today about some evidence-based practices for managing stress, improving mental wellness, and supporting nervous system resilience. Before we get started, I'd like to recognize the path that shaped my own understanding of the nervous system and how we heal. When I was a teenager, I suffered from crippling anxiety. This was a time when anxiety wasn't talked about, a time in the late 70s. So I suffered in silence. Luckily, my mother invited me to a yoga class, and it was the first time I felt relief from my anxiety. I decided at that time to move to a yoga school, an ashram, to study further, and I stayed there for 5 years. It was there that I really began to heal. The fresh mountain air, the regular healthy vegetarian meals, the community, and the daily classes in meditation, breathing, and relaxation are what really changed me. When I left, I started a yoga center in Omaha, Nebraska, and it is the longest running yoga center in the Midwest. We've been there for 40 years, and I continue to train teachers and teach weekly classes. In 1993, I was approached by Dr. Dean Ornish, who's one of the leaders in the field of lifestyle medicine. He was working in collaboration with Mutual of Omaha to do a study to see if lifestyle changes could stop or even reverse heart disease. They needed a yoga teacher to join the program and to teach stress management. So I joined the team, and I worked with the team for over 30 years. We found that people who did this program were able to stop and even reverse heart disease. The first year in the program, we saved the insurance company $31,000 per patient per year. But something else happened. Our team members observed that other chronic illnesses and mental health issues began to improve. While I was working in the program, I began to realize that managing stress is essential to mental and physical health and well-being. I began to see firsthand the power of stress management. If participants practiced stress management, they made better food choices. They were able to exercise in moderation rather than an all-or-nothing kind of exercise regime. And the participants were able to access their feelings with greater ease in their group support sessions, and their own personal relationships started to heal. But most of all, they were able to respond differently to stress. And this had a major impact on their health and well-being. We may not be able to change stressful situations, but we can change our response to stress. And when we do that, we begin to build what's called nervous system resilience. What is nervous system resilience? A resilient nervous system refers to the ability of your nervous system to adapt flexibly and effectively to challenges and to changing environments, and then return to a state of balance or homeostasis. So in simpler terms, it means your body and mind can handle stress without becoming overwhelmed and can recover quickly afterward. Some of the characteristics of a resilient nervous system are, number one, a balanced autonomic response, which means you can switch effectively between sympathetic and parasympathetic. Number two is a flexible stress response, which means you can recover and calm down quickly when the threat is gone. Number three is emotional regulation, which means you can pause, reflect, and respond rather than react impulsively. Number four would be good introspection, which is an accurate awareness of internal body signals. And number 5 is neuroplasticity, which is where your brain and nervous system can adapt and rewire in response to new experiences. And lastly, number 6 is a low allostatic load, or wear and tear from chronic stress. Some of the real-life signs of a resilient nervous system are that you can stay calm under pressure, you bounce back from stress without lingering anxiety, you sleep well and digest food normally, you can be both alert and relaxed, and you can handle change without panic or shutdown. But how do we do this? This is where yoga can help. Yoga is not just exercise. Yoga is a system-based intervention. Yoga is often misunderstood as simple stretching or a competitive workout class. But when practiced therapeutically and intentionally, yoga-based interventions engage the same physiological systems targeted in functional and integrative medicine. So yoga is a complementary therapy. Yoga-based practices can support and not replace evidence-based treatments. The practices work best when personalized and integrated into a broader care plan. We see yoga now as part of many integrative health programs, including cancer care programs, cardiac rehab programs, pain programs, and now functional and integrative medicine programs for mental health. Research shows that yoga regulates the nervous system by reducing chronic sympathetic overactivation and by enhancing vagal tone, which is a marker of parasympathetic strength. Research is also showing that yoga supports a whole system kind of health. It lowers systematic inflammation. It improves self-awareness. It decreases anxiety and depressive symptoms. And it enhances immune function and antioxidant defense, as well as it increases gray matter in the hippocampus. So this is what yoga can do. And I want to talk about the specific evidence-based practices that help us do that. Those practices are gentle movements, breathing, relaxation, meditation, and imagery. Each one of these practices offers research-based results, but when they're practiced all together, they have the most powerful effect on mental health and overall well-being. All of these practices can be found in my book, The Centered Heart, on my website, yourcenteredheart.com. I want to talk through them, and you can refer to the book or my website for some free information about how to use them. Many of you use these practices in some form or another, but often when people are asked to manage stress, they don't know what to do. People will tell me they take up knitting or golfing, or maybe they take up other kinds of unhealthy habits. But what's most important is that while these hobbies may feel relaxing or good in the moment, they don't train the nervous system to react differently, and they don't change the mindset. But these practices that I'll talk about now, they do just that. They help to rewire the nervous system, and they help to change mindset. The first is the practice of gentle movement or somatic movement. These are gentle movements done very slowly with awareness. In the tradition of yoga, we say disease knocks 3 times, and if you don't listen, it takes you. These practices help you listen. They also help to reduce tension and stress and improve body awareness. They support the release of body-stored trauma as well. They also can help to regulate breathing, and they calm the mind. These are best done in a chair. So I'd like to do a few of these movements with you right now. I invite you to sit comfortably. We're going to do a couple of movements for neck and shoulders. So begin by softening your gaze and take a few slow, deep breaths. And now gently let your arms drop down alongside the body. On an inhale breath, raise your shoulders up next to your ears and hold them and squeeze them even more. Hold a little longer as you hold the breath, and as you exhale, sigh through your mouth, and let them go. Just imagine the weight of the world rolling off your shoulders. Tensions exiting through your fingertips. Let's do it one more time. Inhale, squeeze your shoulders up next to your ears and hold them. Hold it even more. Hold the breath, squeezing, squeezing, tensing, and as you exhale with a sigh, let go. Imagine tensions exiting, shoulders softening, and neck relaxing. And now very gently bring your hands over your heart, making some small circles around your heart center. Small circles in one direction and small circles in another direction. And now release your hands, close your eyes, and notice how you feel. The second set of practices are breathing practices. Breath practices can calm and balance the nervous system. They can increase oxygen circulating in the blood. They also lower blood pressure, heart rate, and they can reduce anxiety, improve mental clarity, and decrease inflammatory markers. I want to talk about just 2 breathing practices today, so we can practice them together as well. One is called 2-to-1 breathing. 2-to-1 breathing is simple. It's quite simply breathing out twice as long as you breathe in. I'm going to invite you once again to sit comfortably, close your eyes, and bring your attention to your breath as it comes in and as it goes out. And now begin to track. Keep track of the count of your in-breath. So maybe you're breathing in to the count of 1 or 2. So you can start to breathe out to the count of 2 or 4. It may take several breaths before you can find that 2-to-1 rhythm, so don't force it. Just let it occur naturally over time, having the intention to breathe out twice as long as you breathe in. The count may change a bit as you practice. Just allow that. At some point, settling into a rhythm. This practice helps to upregulate the parasympathetic nervous system, the relaxation response, or the rest and digest phase of the nervous system. It can be done anywhere, standing in line at the grocery store, or even sitting at a stoplight. The second practice is called the buzzing bee breath. This practice is really great for supporting vagal tone. It's done by just buzzing like a bee, almost like you're humming, so that the buzz sound affects only your lips. You can move it then into the nasal passages and even the mind. So it sounds like a buzzing bee. The buzz is done on the exhale breath. And then you'll inhale slowly and practice again. These 2 practices, 2-to-1 breathing and buzzing bee, can be part of your daily routine for managing stress and retraining the nervous system. I encourage you to use them daily. The next practice is the practice of relaxation. One is called progressive relaxation, and the other is called tense and relax. Progressive relaxation is a learned and conscious letting go. Most people don't even realize how much stress they're carrying until they do a practice like this. The practice itself highlights the difference between tension and relaxation. It also helps the body to recover from stress. It improves sleep because it activates the parasympathetic tone associated with deep states of rest and recovery. It also calms the mind and lowers blood pressure and heart rate. And it encourages the ability to let go. It also helps to develop a rest ethic. Most people have what's called a good work ethic, but many people don't have what's called a good rest ethic. So it's training for letting the rest ethic develop in your life, for taking time for rest and making rest important. I want to do a little of this practice, but we'll do it very, very short version. We'll do what's called tense and relax. So I'm going to invite you once again to sit comfortably. And here, begin to let your arms hang down. Set your heels of your feet on the floor and sit back into your chair. Here, as you point and flex your feet, start to squeeze from your feet to your hips as you inhale, squeezing and tensing even more, and hold it. And then, as you exhale with a sigh through your mouth, let go. And now we'll do the same thing with your hands and arms. Squeeze your hands into fists, and squeeze from your fists to your shoulders, tensing your arms as you inhale. Hold it, tensing even more, and as you let go with a sigh, relax. And now in the same way, start to squeeze your pelvic floor, your lower abdominals, your Kegel muscles, and your abdominals. Squeeze and tense as you inhale, hold it. And as you exhale through your mouth, let it go. And now as you inhale, expand your belly like you're blowing up a balloon in your lower abdomen. And as you exhale, imagine popping it, letting it go with a sigh through your mouth. And then again in your chest, same thing. Inhale and expand your chest. Hold it, and as you exhale with a sigh through your mouth, it's like you're popping a balloon. And then let the breath return to normal. And now squeezing all of the muscles of your face towards the tip of your nose, making a prune face. Tensing even more as you inhale, holding, tightening, and as you exhale, let it go. So now let's do the whole body all at once. Pointing and flexing the feet, squeezing the legs, squeezing the hands, squeezing the arms. Inhale, squeezing abdomen, big breath, expand the abdomen and chest, squeezing facial muscles. Shrug your shoulders, and as you exhale with a sigh, let everything go. And just let yourself be still for a moment. Imagine tensions exiting through your fingers and through your toes, sinking and settling. And when you feel ready, open your eyes. The next technique is the practice of meditation. Meditation, quite simply put, is just focused attention on one object. Meditation has been proven to increase concentration and attention. It improves emotional regulation, it reduces anxiety, and enhances stress resilience. It increases the threshold for stress by allowing your fuse to get longer. So some of the research shows that in just 5 days of 20 minutes of meditation, you can improve stress resilience and reduce emotional reactivity. Meditation also provides insight and inspiration. It activates brain regions related to self-awareness and meaning-making. There are a lot of meditation practices, and not every practice is for every person. Some meditation practices may have more of an external focus, so things like focusing your attention on a candle flame or walking meditation. Whereas other practices, you may use an internal focus where your attention is on breath or a feeling. Other practices include counting breaths or using a mantra. So every meditation technique is a little bit different, but it's not one size fits all. So what I mean by that is some people who may suffer from PTSD may not want to close their eyes to meditate, so walking meditation is a much better choice. Some people who have difficulty closing their eyes may also like working with candle gazing meditation, where they use their gaze to look at a candle flame, and then just gently as they close their eyes or soften their gaze, they can imagine the candle flame behind their eyes. And when that image disappears, they open their eyes again. And this kind of toggling between an internal and external awareness can be really good for some people who suffer from different kinds of anxiety or PTSD. I'd like to invite you to experience a counting meditation today. So this is one that can help a lot of people who have trouble concentrating. So once again, I'm going to invite you to get comfortable. Sit in your chair and just gently either close your eyes or let the gaze of your eyes soften downward. Maybe a half open, half closed kind of gaze. You decide what works for you. And we'll do a practice of counting the breaths. Every time you exhale, you'll count to yourself internally. So the first exhalation is number 1. The second is number 2, and so on. You'll count to 12, and if you lose count during meditation, start over. There's nowhere to go, there's nothing to do, but just observe the mind. So as you're counting, you can also watch what arises in the body and mind without judgment or comment, without analyzing or ruminating. Just simply allowing things to arise, and as you loosen your grip, they fall away, always returning your attention to the count. When you feel ready, begin the count. We'll just be here for a few moments practicing. If the mind wanders or drifts, start over. Notice what's arising without judgment or comment. You keep track of the count, and I'll keep track of the time. If you reach the count of 12, just gently start over. When you feel ready, let go of the count. Let the gaze of the eyes fall open and downward, and slowly raise the gaze, noticing how you feel. This practice can be done morning or evening, or anytime you have a few moments to sit quietly. The last of these 5 practices is called imagery. Imagery is the practice of using the imagination to support a positive outcome. It can aid in the release of endorphins, and it's been shown to change negative thought patterns where you can rewrite the internal narrative. It also aids in decreasing depression and PTSD symptoms. And most of all, it really supports healing. So I want to talk a bit about the different kinds of imagery. There's one kind of imagery called specific imagery, where you actually go in and try to specifically think about healing a certain area in your own body or mind. There's another called non-specific, and this is where you might imagine yourself in a place in nature, and you might imagine what it looks like and feels like, what it smells like, and through that imagining, you can sense and feel those deep feelings of peace or joy, and hold on to those. Those feelings can be healing. Another imagery practice is the practice of affirmations or restructuring self-talk, and I think these are incredibly powerful. Imagery and affirmations support the reframing of internal narratives, which can align with cognitive restructuring techniques in psychotherapy. So I'd like to just do a little brief healing imagery practice. I'm once again going to invite you to sit quietly, and you can close your eyes and let the gaze of the eyes soften downward. Now take a few slow conscious breaths. As you sit quietly, let the whole body and mind begin to power down, begin to relax. Imagine healing light or healing energy sitting just above the crown of your own head. Imagine that energy, that light being powerful because it's a combination of all of the energies in the elements around us. The energy of water, earth, air, and fire, and ether. You can imagine energy as a color or a vibration that feels particularly healing to you. And as you hold your attention to that lighter energy, let it get stronger, more powerful, and brighter. And then begin to imagine calling that healing into your body, sending it over the mind and healing the mind. Sending it down the spine and through the nervous system, through to the vital organs, down the arms to the fingers, down the legs to the toes, letting it touch every fiber of your being, creating a powerful healing shift, a powerful healing experience. As if you could feel that light shining in every cell, transforming and healing at the deepest level, knowing that something deep inside has shifted. And now tucking away this healing light, this healing energy, into your cellular memory for safekeeping, where you can return to it and use it whenever you need it. When you feel ready, gently open your eyes. So we've talked about the 5 techniques that are powerful practices for rewiring the nervous system and building nervous system resilience. Using yoga to help build a resilient nervous system just takes a regular practice. And when you practice regularly, you'll start to notice the changes. The things that used to bother you won't bother you in the same way. And you won't find yourself in the middle of a crisis trying to find something that works. I often say this is like trying to take swimming lessons when you're drowning. It doesn't work. But if you start with these practices, you'll be building a resilient nervous system. So when the time comes, your nervous system will be there for you. All of these practices can be found in my book, The Centered Heart. And that book is on Amazon, or you can get it in your public library. The book also has scripts in it that therapists can use to record practices for their patients, and patients can use for themselves as well. You can also find free audio practices on my website, yourcenteredheart.com. There's also a paid library called The Centered Mind, and this can be used by practitioners and patients alike. There are 3-minute practices and 10-minute practices and 30-minute practices, even a 60-minute practice, all curated just for you, depending on your level of need. I hope that you'll explore some of these practices that yoga has to support mental wellness. And thank you so much for joining me today. Be well.